this is the first time that Dr. Bob Gill has come on to the Crispin Flintoff show. Thank you for agreeing to come on during the summer. Are you still busy in work, Bob?
Yeah, still working hard, and it's a real honor to be on your newly titled show.
Yeah, well, I just thought Andrew Marr didn't deserve any more attention, so
I agree.
I asked you in an email if you could talk about what's happened in the first month under the Labour government, and you said sure, but you said I think you should look at this. So and you sent me a clip, which is incredible because it's you at the BMA talking to the BMA about what you've seen, and I'll just play it so everyone can see it, and then we'll talk after about what you say in there.
I'm Dr. Bob Gill. I'm a GP. I've been following very closely the privatisation of the NHS for over a decade. What I've heard today is reactive downstream, running around like headless chickens. The BMA has had ample opportunity to significantly halt, upend and inform the profession and the public about what's happened. The NHS has been essentially repurposed. This has happened by stealth. Some key steps have been the creation of a two-tier GP employment system, a status of principals and salaries. We had a decoupling of seeing patients with income, so now you could have entrepreneurial GPs never seeing a patient and earning very handsomely. We had the BMA going into an agreement with government called the Social Partnership Forum, which is essentially agreeing to rubber stamp all the privatisation in 2006. In 2012, the BMA had an opportunity to raise public awareness about the Health and Social Care Act. Nothing happened. 2015, we had the NHS long-term plan and the 5-year forward view, all indicating the direction of travel of government, which is the American system. And in 2022, July, we had the Health and Social Care Act, which has now created 42 new legal entities called integrated care systems, as we've been hearing about slightly. These are for-profit entities. These are dominated by private corporations. People like United Health, who effectively in South East London have a monopoly over ownership of GP data systems through their purchase of EMIS. We have United Health, who's purchased 14 Fish. So United Health, an American insurer, has ownership of data involved in the training of GPs through their UK subsidiary Optum. So we now have a NHS which does not have a duty to provide health care. It has a duty to promote. The duty to provide was removed in 2012, effectively abolishing the NHS legal status. The tone of the discussion is, oh, if only government knew better, oh, this is incompetence. This is a very well thought out plan that has been taking place, delayed slightly with some activism, but they have got to where they want to. Now, the idea that West Streeting and Keir Starmer are listening to the public or opposition is deeply naive. The people sponsoring these politicians of whatever complexion are people like BlackRock, Larry Fink, who's endorsed Keir Starmer, and people like West Streeting, for example, who's received 175,000 donation from those with interest in private healthcare. Now, what did the BMA do? The BMA endorsed the white paper in 2021. The BMA championed the ARRS scheme. I was one of 3 people who went to Belfast in 2019 to clearly and explicitly point out this was a disastrous step for the BMA to endorse, because this is clearly a doctor substitution scheme. It's not in our patients' interest, the taxpayers' interest, or our interest to be promoting a doctor substitution scheme. We've heard nothing about the doctor substitution agenda. I said comment. Well, I'm talking to you. I said I'm commenting on what I'm hearing tonight. It's not my fault I'm well informed on the subject. And clearly you are not. Yeah, I'm giving a history lesson because it's totally missing from your analysis. It's totally missing from the messaging, which is simplistic. And I'm wondering, is it a deliberate policy of corporate BMA to keep the public and the members in the dark? Because it's far easier to get compliance. And in terms of the solution, you're attacking an elephant with a pea shooter. Those work to rule and I'll do this and I won't do that. That's not going to do anything. The BMA needs to decide whether it wants to represent patients and working doctors, not those entrepreneurial ones who have multiple jobs up their sleeve. Decide what you want to do and make it clear to the public and call for what we need, which is actually renationalisation, or take a step which will put the government under significant political pressure. Because what I've heard today will just carry on the attrition of the profession. People are walking out of the profession. You're not protecting contractor status, independent contractor status, by doing nothing to stop the exodus. And what I've heard tonight does not stop the exodus. Thank you.
Thank you, Bob. I really appreciate actually your honesty and your candour. And if you and I had been in charge of GPC a long time ago, who knows what wonderful things we could have achieved together. But alas, we are where we are, we're here now, and we're doing the very best we can, and I don't think we can work any harder. So I think we're just going to have to trust us like 99.2% of those 19,000 GPs did in March, because my goodness, from the conversations I've had today, I'll tell you now, people are very worried.
Well, that last bit seems to be being humoured a bit, fobbed off as well. And you talked about the elephant, shooting an elephant with a pea shooter, and that they're not going to put the government under pressure. Can you tell us what the BMA were proposing?
Well, what they've suggested is, in effect, a form of working to rule, erecting barriers to work being dumped on general practice from secondary care, limiting access of patients to GPs to 25 consultations a day. So, and it's also left down to the individual practice to decide what form of working to rule they will participate in. So it doesn't strike me as an effective tactic to overwhelm government and have a dramatic change in policy. You know, I waited until all the presentations were finished before I made my comment, in the hope that we might hear some realistic analysis, accurate analysis of what's gone on. But you know, as you heard, I was not impressed with what we were being told. And I'm convinced that at every opportunity, the BMA is persisting in maintaining ignorance of their members, because that suits their agenda, I'm afraid, because the less the members understand, the more they can get away with this performative theatre that we're being subjected to.
So effectively, the action that they're proposing is just, as you say, performative. So it looks as though they're standing up against the government and any means of any way of undermining the profession, but it's actually just a small thing that won't make any difference in the big picture of the privatisation of the NHS. So is this something that you've sort of said this before about some of the unions, that they pose as though they're doing great work, but actually they're not doing us the service of telling the public what's going on, and like you say, raising awareness, telling everyone that the NHS is under threat. They're making out that it's just about how many consultations a GP has to have a day.
Yeah, and the tone totally neglects the fact that this has all been very deliberate. So we are in a manufactured crisis. And if you want to win a political argument, it helps that the public understand. And they're doing nothing to explain what's gone on to the NHS. So the NHS, as we think it was, doesn't exist anymore. We have a series of broken up systems of healthcare, which are increasingly dominated by the private sector. Well, that is not the NHS. You know, the basic principles of the NHS were tax-funded, free at the point of use, universal, comprehensive, and provided by people employed by the NHS, so you could control the quality. Now, most of that has been eroded or weakened, and they don't recognize it, and they don't point this out to the public or their members. So if you want to win an industrial dispute, it's your responsibility to inform and engage the public in your fight, and that's not been going on.
Right. And the thing that seemed to get a response from someone who was sort of trying to interrupt you was when you talked about the doctor substitution scheme. Is that the physician associates issue?
Exactly, yeah. So this is something that the BMA promoted back in 2019. And this meeting I went to was the BMA General Practice Committee meeting. This was the branch of general practice, and there was no discussion of the impact of the ARRS GP substitution scheme, bringing in physicians associates, other than to say, if we're lucky, some of the budget we might be able to spend it to recruit GPs. So it was utterly pathetic. And let's remind ourselves that privatization, a key element of that, is to water down and dumb down the workforce and remove expertise out of the system. Well, I think that's pretty important for a GP committee of the BMA to be talking about, but it was missing from the discussion.
Right. And this physician associates issue was something that was being sort of highlighted and people were alerted to before the general election. You've also just sent me a clip of a couple of people discussing it. Maybe I'll just play the clip. Maybe you could just tell us who they are.
You know, it just seems to me that the PAs, their training, their experience, their DNA really makes them perfectly positioned to take that kind of holistic look at the patient, which it seems is the underlying value of an ACO. Does that resonate with you?
Oh, absolutely. In fact, the whole premise of ACOs is it's primary care based.
Right.
And it's cost efficient and high quality. Who's better to be at that table than the PAs? Because the PAs today cost less than a primary care physician. They provide high quality care. If they operate at the top of their license, they can provide really efficient care to the system. So yes, at the end of the day, when our focus is on improved quality and lower costs, the PA is perfect for the accountable care organization movement.
PA is perfect. So who's saying that? I mean, it's obviously not people from this country, but why did you think that was significant?
Right. So this was a clip shared on Twitter by Nico, who's been commentating on your show previously, and these are two American commentators peddling, promoting, marketing the advantages of physicians associates in America. Now, that's clear evidence that this is an idea that's come from America. America does not have high quality primary care or general practice care that the UK did have and is quite happy to dismantle. And you can see where it's coming from. So in America, they call it ACO. And in the UK or in England, they're calling it integrated care systems, but it's the same model. And this is a model which wants to use the cheapest possible staff working. One comment he made was at the top of their license. Well, that's a polite way of saying getting them to work when they're not completely confident or competent in what they're doing, right? Top of your license means pushing the boundaries. So this is a race to the bottom, a de-skilling agenda, which comes from America, as clearly demonstrated in that clip, which we are blindly following. And analysis from America is saying, actually, this has been a bit of a disastrous experiment. And they used it where they had, an undeveloped, very badly resourced and very badly staffed primary care system, which wasn't our problem in this country, but it has become a problem because consecutive governments have downgraded the NHS.
Right. And the hoodwinking, the kind of language they use is so misleading, isn't it? Or as you say, you can unpick it, but you have to have an ear to understand what
Yeah,
they're trying to say there.
it's a sales pitch. So, they're saying these PAs are cheaper. Well, what is the effect of cheaper, less experienced staff? It means people are misdiagnosed. It means people will be harmed unnecessarily or die unnecessarily. Now, if that doesn't affect the bottom line to these business types, that's a good outcome, because they have no concern about what happens to patients. It's all about profit. And we've seen time and time again that when you put profit first in the delivery of essential public services, well, the quality suffers. And probably the most barn door example is if you look at our privatized water systems, where they're sucking out billions in profit whilst they pump raw sewage into the rivers and the waterways of this country. That is how the private sector works. And while they're doing that, whilst they're extracting profit and pumping raw sewage, they're also saddling the industry with debt, which the public purse will have to bail out sooner or later. So it's a totally dystopian system being applied to healthcare.
Has Wes Streeting or anyone back to the sort of Labour government, has Wes Streeting or anyone in the Labour government talked about physician associates or had any concern about them, expressed any worries on it?
Well, there seems to be a bit of a response by promising to open up the budgets to allow the employment of doctors using those budgets that were ring-fenced for PAs. But interestingly, these doctors that will be employed won't be working for a particular practice. They'll be working for the integrated care system or the primary care network. So these will be like employees who don't have any fixed surgery, who can be shifted around as and when necessary. Now, that's not a particularly attractive job for a doctor, because one of the key elements of being a GP is continuity of care, right? So that's out of the window. So this is a bit of a bung to try and pacify growing GP and GP, the young GPs' frustration at being unemployed after 10 years of training.
Wow. So they're trying to fob young GPs off with a job that no one would want, where they can't keep control of, they can't keep up with patients, they move around. That can't be good either if you don't actually have the same patients you're seeing, because you won't know.
Well, that is not why people go into general practice, right? If you didn't want continuity of care, you just wanted to treat patients one after the other, well, you go and work in A&E, right? You do that as a career. But the point of general practice is stability and knowledge of the patient over a long period of time, which is very efficient, which saves lives, which gives job satisfaction and patient satisfaction and builds trust. Now, all those human qualities are being abandoned, and medicine's being turned into a transactional relationship, like going to the shop and buying a packet of crisps or whatever. You never see the same shop assistant twice, right? Because it doesn't matter. But in healthcare, it does matter. And we know that continuity of care improves quality of medical provision and actually saves lives. And that is being abandoned. So that the system being pushed down our throats ultimately will be much more expensive and do a lot more harm and cause a lot of more damage to patients than what it is replacing, I'm afraid.
Now, what else have we got from Streeting's Labour? I mean, are they pushing? I mean, I saw something about how they need to have a full review of the NHS or something. I mean, and we've got this guy, Lord Darcy, who's had connections with private healthcare. Has anything emerged from that, or has anything else been happening that you can read into?
Yeah, so they've put in an offer to the junior doctors. The junior doctors are putting this offer to their members, but it's nowhere near what they originally wanted, which was full pay restoration. So that is in the pipeline. I'll just adjusting my lights here. So what the junior doctors have decided is they're not going to get a better offer, and they've decided to put that offer they've got to their members, with the view to continuing the fight, promising to do more industrial action, but to to bank the changes that they have managed to drag out of the Labour government. So that's the situation with them. But West Streeting has hired people from the Blair Brown era. So you talk about Lord Darcy, you've got the Chancellor of the Exchequer talking about rehashing the whole PFI financing of public infrastructure projects, which has blighted the NHS. You've got Peter Mandelson on the scheme, and people like Alan Milburn, who has profited handsomely out of NHS privatisation. These are the same people under Tony Blair and Gordon Brown that saddled the NHS with PFI debt and started outsourcing medical services for the first time in NHS history. These are now surrounding West Streeting and Keir Starmer. So there's a continuum of policy stream. They've done nothing to make me have any hope that they're going to reverse the privatisation. They're just carrying on the programme.
Right. So we'll just hear what their actual detail of that later on, I suppose. But it's not anything that we can be hopeful about. What do you think we should be pressing the Labour government on of most urgency? Would that be physician associates?
I think before we press the government, we need to press our unions to say we are paying your membership fees and you are selling us down the river. And those unions need to do a ratcheting up of public and membership awareness of what's going on. And through that pressure, we force the government to do the right thing. But directly pleading to government will get us nowhere. We'll just be served up a whole new succession of lies and complicated jargon just to confuse us and to keep us hoping for the best. So it takes public awareness to achieve anything, I'm afraid, and the unions have a big responsibility to, wake up and smell the coffee, because their members will be suffering just as much as everybody, all the other members of the public, when they lose access to a doctor and when they lose access to medical care at hospitals, because that's what's happening now and will only get worse as this agenda continues.